Thank you for that introduction and for having me today. My name is Kathleen Cavanaugh, and I'm a nurse practitioner in Integrative Oncology at the UCSF Osher Center for Integrative Medicine. And I'm going to give a brief overview on Integrative Oncology and talk a little bit more in detail about acupuncture, cannabis, and mind-body modalities. So, integrative medicine use in cancer, we know that upwards of 90% of people diagnosed with cancer utilize different forms of integrative interventions. And less than half of them discuss this with their oncologist, which is concerning, and something that I would encourage you to do more is to bring forward what you are considering and what you are using. A major predictive factor of whether or not people are going to use integrative modalities is social support. Expectations around what they're getting out of it is increased longevity or that it might cure their cancer. And these expectations are more so if there is family endorsement for use. So a definition of integrative oncology is it's a patient-centered, evidence-informed field that utilizes these modalities alongside conventional cancer treatments. And I've underscored two words, alongside. The goal here is that you're using these interventions in conjunction with your conventional cancer treatment, not as opposed to or forgoing any conventional treatment. And evidence-informed rather than evidence-based. And we use evidence-informed because in integrative oncology, we often don't have the same level of evidence that some of the prescription medications have. But look at the safety of the intervention and use that to guide your decision of how much evidence you need. I always say that an integrative approach is like a wheel, and you want to try to put as many spokes in that wheel as you possibly can. So it highlights that there's many things that you can be doing, and that it's not really just about one intervention. You want to look at all aspects of self, so what you're going to do for your body, mind, and spirit. And one challenge that I like to give people is to think about what you're going to do for your mind and spirit. Or another way to frame it is, what can you do for your heart and your soul, not just always focusing on the physical aspects. The National Center for Complementary and Integrative Health has outlined 5 domains of complementary and alternative medicine. So there are manipulative and body-based methods such as massage, mind-body medicine such as mindfulness, hypnosis, meditation. There are alternative medical systems like traditional Chinese medicine, homeopathy, naturopath. There are energy-based therapies such as acupuncture, also Reiki, healing touch, and then the biologically based therapies like diet and supplements. The World Cancer Research Fund and the American Institute for Cancer Research, the largest organizations doing work on diet and lifestyle for the prevention of cancer. But as you can see in the bottom right-hand corner, after a cancer diagnosis, it's recommended that you continue to follow these above guidelines. And going up on the left-hand side, it is about maintaining a healthy weight, being physically active, eating a plant-based diet, and reducing processed fast foods, red and processed meats, sugary drink, and alcohol, and not using supplements for preventing cancer. So a quick word on the gut microbiome. This area of science is this understanding that our digestive tracts are comprised of trillions of microbes and bacteria. And in cancer, what we're learning is the more diversity of healthy gut bacteria you have, the better your immune system, also the better your mental health. And in order to get a wider array of this healthy gut bacteria, you want to be eating a fiber-rich diet, which is where the guidelines for an anti-inflammatory plant-based whole food diet comes from. So it's these high fiber plant-based foods which feed the healthy gut bacteria. The plate here on the right is the challenge to try to get more plant-based sources of protein in addition to your fruits, vegetables, and whole grains as your digestive tract tolerates it. And to primarily stick with food sources, not using supplements, which are not as effective and often not absorbed as well. And just a quick word, this article really highlights that visceral obesity and metabolic syndrome are risk factors for neuroendocrine tumors. Metabolic syndrome is defined as having all three of these bullet points, but any one of these factors, whether it be elevated waist circumference, fasting blood glucose levels, triglycerides, insulin issues, are risk factors, and diet is an intervention to help reduce this. In addition, an intervention is exercise. And this comes from the American College for Sports Medicine. You can actually download this PDF from their website, and it gives several different specific guidelines for aerobic and strength training exercises for different symptoms that can come up in cancer and cancer survival. And at the top, it's basically saying that you need to hit a minimum of 150 minutes a week of that aerobic activity and strength training at least twice a week. Another thing you could consider is bringing in mindfulness to your eating. And this paper here outlined and concluded that the practice of mindful eating helped with reduction in food cravings, portion control, body mass index, and body weight. So a little bit on acupuncture in cancer care. We know that people with cancer tend to use acupuncture more as compared to those without cancer. In 2017, almost 90% of NCI-designated cancer centers were offering acupuncture. And it is recommended in the SIO and ASCO guidelines for breast cancer treatment. And the SIO, which is the Society for Integrative Oncology, looked at evidence for acupuncture and symptom management and found strong recommendations for its use in the symptoms listed below. Another recent study done at a hospital system in Ohio, where they looked at inpatient, outpatient acupuncture programs, an employee group acupuncture program, and they also looked at utilizing a sliding scale payment model because one of the barriers with acupuncture is cost. In the outpatient assessment, they used the Edmonton Symptom Assessment Scale, and they gave the survey before and after each weekly session. It's a scale of 0 to 10, where you rate your different symptoms, and a change of 1 was considered to be statistically significant. And what they found, again, in outpatient pre and post acupuncture sessions, before is blue and after is green, and across the board with all symptoms, there was a statistically significant reduction. The two that were most reduced were pain and neuropathy. So for acupuncture in cancer, we know that it improves symptoms of chemotherapy-induced nausea and vomiting, and likely nausea and vomiting that comes about from any treatment. It is effective in reducing insomnia. There are new studies emerging that it can be helpful in reducing neuropathy, and it definitely helps with pain reduction. So a little bit on cannabis. The cannabinoid receptors, CBD1 and CBD2, can modulate some cancer symptoms. And CBD1 and CBD2 are targeted by cannabis. Opioid and cannabinoid receptors have overlapping neuroanatomical receptor distribution. And they have looked at the use of concurrent opioids and cannabis. And in the HIV/AIDS research, there was no safety concerns in that it did not raise blood levels of opioids, and the people using the cannabis in conjunction with the opioids needed less of them. And cannabis-based medicines, not only can they help chronic pain, but they tend to have a favorable safety profile compared to the opioids. Of what we know, CBD has anti-inflammatory effects, and THC, which is the psychoactive component, is very good for mood and sleep. Delta-9 tetrahydrocannabinoid, which is the main active cannabinoid in the plant, has been FDA approved and available in a prescription medication for several years. One of my mentors always says that cannabis is a single intervention that can assist with a multitude of symptoms, and that it certainly is of value and can be added to other treatments. Many do advise against inhaling, although the evidence for serious harm is pretty scant. If you live in a state where you have a variety of other methods available, you can explore other routes, mostly oral. But there is also topical, and in this study, they looked at topical CBD oil for peripheral neuropathy, and applying the CBD oil daily for 4 weeks statistically reduced intensity of pain, sharp neuropathic pain, and cold and itching sensations in the CBD group compared to the placebo group. So topical is another route to consider. And then as far as dosing, this paper was a consensus-based dosing recommendation paper. And globally, they got together healthcare professionals from a variety of different backgrounds, including oncology and pain. And the recommendations were, especially if you're naive to cannabis, to start with a 5 milligram oral dose of a CBD predominant product and to begin it once or twice a day. And then you can increase that by 10 milligrams every 2 to 3 days to about a max dose of 40 milligrams or to your desired effect. If needed, you can add in THC, but to start at a very low dose of 2.5 milligrams and then increase that maybe once, if not twice a week, to a max dose of about 40 milligrams. So this is a great paper giving some guidance on how to begin with dosing. And then just a few words on the emotional and mental components that come up with a cancer diagnosis, ongoing symptoms, treatment, and living with a chronic condition. And how do you help with that? Well, this is where the mind-body modalities come into play. Here is a list of some examples of things that you can do to intervene and help you with your coping. This list is not exhaustive, but just examples. And Dr. Richard Davison from the University of Wisconsin has done a lot of work on understanding what happens in our brain when you utilize mind-body modalities such as meditation. And he has come up with the 4 components of emotional well-being: awareness, insight, purpose, and connection. And these are aspects that can be manipulated. So you can improve all these aspects by practicing mind-body modalities. And if you're interested in a resource, the Healthy Minds app is 100% free. You can download it on your phone, and it gives you a little tutorial and then a guided meditation, which will improve all of these aspects of emotional well-being. And then when you use mind-body modalities, what you're really doing is cultivating resiliency. And this is one of my favorite quotes. It's not the load that breaks you down, it's the way you carry it. So what this is really saying is that it's not the stress, it's how you cope with it. We don't have a lot of control over stress. What we do have control over is how you cope with it. And if you practice mind-body modalities, you will cultivate resiliency to stress. So in conclusion, if for nothing else, integrative oncology will help to increase a sense of control over something that you don't have a lot of control over. For the most part, you can try to control your weight. You can certainly alter your diet, increase physical activity, use supplements appropriately and safely, become aware of your breath and your breathing, which is free and always with you. Consider guided imagery or other forms of meditation and relaxation. Connect with family and friends, and then also engage in spirituality and religious practices. So thank you for your time and attention, and I hope you found this of benefit.